Hi, I'm Dr. Shana Johnston,
And I'm Dr. Julianne Reamer.
and we're two of the doctors at Grow Health. We'd first of all like to congratulate you on your pregnancy. This is such an exciting time, and we're so excited for you. We're absolutely delighted that you've chosen us to travel with you on this journey. We hope you have a really great experience with us. I'm going to first of all tell you a little bit about Grow Health and about us and how we work and what you can expect during your prenatal care. Then Dr. Reamer is going to tell you a little bit about how to stay healthy and safe in your pregnancy and introduce the topic of genetic screening. We have a separate video on our website where Dr. Caitlin Harmon will tell you a lot more detail about genetic screening, and we encourage you to watch that as well. At Grow Health, we're a group of family doctors with a passion for maternity care. We absolutely love babies, and we're so excited that you've chosen us to care for you during your pregnancy, your delivery, and the early days of motherhood. The doctors from Grow Health have actually come from a wide variety of medical backgrounds, and collectively we have decades of experience. We've come together because we have a shared interest in doing things in new and innovative ways, in supporting each other in our ongoing learning and continuing professional development, and above all, to provide great care to our patients. We're actually currently the only group of maternity doctors in Victoria who all work in the same clinic. This means that the doctors that you'll see around the clinic are the same doctors who will be sharing in your care at the hospital. We encourage you to come see us at the clinic for any issues that come up at all during your pregnancy. We're all experienced family doctors and can help you address all of your health needs. So in addition to caring for you during your routine prenatal care, we're also here to help look after you when you have a cold or flu, if you're having problems at work, you're having relationship issues, or other medical issues arise during your pregnancy. Anytime a problem arises in your pregnancy, we'd prefer that you come see us rather than going to a walk-in clinic, since we have a better understanding of your health needs than a doctor you haven't met before. We have a number of rapid access appointments set aside every day, so that even if your primary care doctor isn't in that day, you can be seen by one of the doctors on our team. We all share the same electronic medical record, so we'll have access to all the information we need about you and your pregnancy. For urgent issues, you also have access to the doctor on call, who's available 24/7 at the number on our website. We take turns being on call 24 hours at a time, and this allows us to be at the hospital as much as necessary during that time without having to run back and forth to the clinic. We're therefore available to check on you regularly during your labor and watch you closely for any problems. We're also available to take phone calls if you're at home and you're worried about something, and if need be, we can see you at the hospital. The doctor on call will also visit all of our patients every day in the hospital on our hospital rounds. So we'll be by to check on you, go over any concerns that you may have, and help you decide when you're ready to go home. After you go home from the hospital, we'll see you regularly in the clinic until your baby is about 2 months old. At that time, we'll refer you back to your family doctor, or we'll help you find a family doctor if you don't already have one. Again, during that time, if you experience a problem either with yourself or with your baby, we encourage you to call the clinic, where we'll have one of our team see you, ideally that same day. We want you to know that we're there for you, and that we're happy to see you if a problem comes up at any time while you're under our care. Now I'd like to tell you a little bit about what you can expect during your visits to Grow Health. At your first visit, we have a lot of information to go over. So to help us make the best use of our time together, we've developed a questionnaire that we'd like you to ideally complete before your first visit. You can download this form from our website and bring it with you. If that's not possible, we do have copies at our office that you can come a few minutes early and fill them out prior to your appointment. At the first visit, we'll review this information with you and get some extra details if necessary. We'll order routine blood work and ultrasounds, discuss genetics, discuss prenatal screening, and go over your questions, as well as give you a copy of a book called Baby's Best Chance, which has lots of great information in it. On your second visit with us, we'll do a complete physical examination, as well as a pap smear if you're due for one. We'll review the results of your tests from your first visit, go over any questions that have come up in the meantime, and ensure that any screening that you want has been ordered. After that, we usually see you about once a month until the third trimester, and then about every 2 weeks until the last month when we see you every week. If during that time, however, there's ever any issues that come up, as I mentioned, if you have any medical issues that arise, please feel free to call us and make an appointment. We're happy to see you at any time to discuss any problems that come up. Just a few more things I want to go over before I hand things over to Julianne. The first thing is that at Grow Health, we think it's important to help with the education of our future doctors. So we have medical students and residents that work with us both at the clinic and the hospital. They're the future of our profession, and we hope that you'll help us in educating skilled, caring doctors for future generations. We'll never give them responsibilities that are beyond the scope of what we think that they're capable of, and they're always under our direct supervision. Secondly, we want to let you know that there are times when we'll be away on vacation or at a conference to further our education. At these times, we'll have a locum doctor cover for us. A locum doctor is a fully qualified doctor with the same set of skills that we have, who helps us with coverage in the clinic and at the hospital when we're away. We're fortunate that we have an excellent group of locums who want to work with us, and we're sure you'll be very happy with their care. The last thing I want to mention is that I encourage you to take a look at our website for more information. We've got photos and biographies of each of the members of our team. We have a resources tab with lots of great information, and recently we started a blog where we plan to post information about new things happening at the clinic. One of the things we're working on is group visits. We just recently held our first labor and delivery group visit, and we hope to be having more of them soon, so stay tuned.
So I'm Dr. Julianne Reamer, one of the family physicians at Grow Health. There's a lot of information out there about what is good to do in your pregnancy and what is unsafe to do in your pregnancy. The next few minutes are going to be devoted to addressing some of these important topics. Firstly, food. What to eat, what not to eat. Let's start with the don'ts. Best to stay away from anything that is not fully cooked. That's all your meat, eggs, and fish. Best in pregnancy to stay away from anything that is not pasteurized. That's all of your dairy products such as yogurts, meat, cheeses. Especially watch out for those soft cheeses like brie. Those often are not pasteurized. Make sure all the labels say pasteurized on them. Honey also needs to be pasteurized. Lastly, best to stay away from anything smoked or cured or processed in the deli section unless it has been fully cooked before you eat it. So for example, okay for ham or pepperoni on a pizza that has been baked in the oven, but no go on the sub or even a toasted sub. Lastly, leftovers, they get 2 days in your fridge and then they get tossed or your partner eats them. And in those 2 days, heat it good and hot before you eat it. So the bottom line here is that pasteurization and heating the food fully kills the germs that can potentially not only put yours but baby's health at risk in your pregnancy. So eat smart. So what can you eat? Canada's Food Guide has some great recommendations in this regard. The motto, everything in moderation, really applies here. Even those mercury-containing fish such as tuna. Aim for nutrition rather than calories. Steer towards whole grains and fruits and veggies. Stay away from processed quick carbs such as muffins, cookies, candy, etc. Save those for an occasional treat. Ensure that you have a good amount of iron in your diet as well as calcium. Check out the food guide for specifics on numbers of servings per day. Caffeine is okay as long as it is 1 cup of strong coffee or less per day or its equivalent. Artificial sweeteners are probably okay too as long as it's not more than 1 per day. And now a little moment on the non-food extras. Alcohol is a no-go in pregnancy. There is no amount of exposure that is safe in pregnancy. Its use can interfere with a developing baby and lead to lifelong, lasting effects on child's development and growth. So steer clear now that you know you're pregnant. You may have had some before you knew that you were pregnant, and oftentimes this ends up being fine. If you are concerned at all with the amount that you've been exposed to, please address this with your care practitioner. The thing that matters the most is what you do going forward. You can't change what happened in the past, but you can change what the baby is exposed to from here on in. Along the same vein, smoking is not recommended in pregnancy. It increases the risk of preterm birth and low birth weight infants. Plus, the additives to the nicotine have a whole other host of issues that they can cause in pregnancy that we're just starting to understand. If you are a smoker, please consider making a change, not only for the pregnancy, but to decrease risks of things such as SIDS after the baby comes. Same for marijuana use. Marijuana has just as many harmful additives added to them that can threaten the safety of pregnancy. We are here to support you through this. Please talk with your care practitioner about these things so that we can discuss how best to support you, either to use them minimally or even to consider making a change to cut them out completely. Over-the-counter drugs and vitamins should be checked out before you take them. Even natural remedies can have harmful effects on a developing baby. You can check with one of us at your next appointment or ask a pharmacist. They are also a great wealth of information. Or visit the Mother Risk website that is listed under useful links. Better to check before you take. A common question we get asked is it safe to have intercourse during pregnancy? There are no studies that prove that women who abstain during pregnancy have any better outcomes than women who do not. However, there may come a point in time during your pregnancy where we advise you to go on pelvic rest or no sex. This would be if the placenta was too close to the cervix or if the baby was threatening to come too early. Pregnancy changes your body, so expect some light spotting after intercourse from increased blood flow to the area. However, heavy bleeding or cramping should prompt you to stop and to seek medical attention from your care provider as soon as possible. Exercise in pregnancy is very beneficial for mom and baby's health. You may find your energy to be lower in the first trimester, as many moms do, but aim to have some light to moderate exercise most days of the week in as many of the trimesters as you can. This should reflect about the level of activity that you did before pregnancy. Do not start training for anything during pregnancy, but if you are a runner, for instance, it is reasonable to continue going at the same or slightly lower intensity. Avoid overheating and avoid working out to exhaustion. Ensure you bring some healthy snacks with you for afterwards, and if you are inactive before conceiving, talk to your provider about the activity that would be right for you. Labor is work, it's hard, and you will do better showing up to the labor and delivery room with some stamina. Plus, it will aid in keeping your pregnancy weight at a healthy level. So speaking of pregnancy weight gain, how much should you be aiming for? We've all heard the expression, a healthy pregnancy is worth the wait, W-E-I-G-H-T. Pregnancy may take about 20 to 30 pounds weight gain for someone who has a normal body mass index. For someone underweight, the gain may need to be closer to the 40-pound mark. If someone has an overweight or obese body mass, then weight gain should be probably no more than 10 pounds. It is even reasonable not to have gained anything during the pregnancy in some instances. Talk to your care provider about what your goal weight gain should be. One last thing to mention is that flu shots are recommended in season during pregnancy. They are well studied and safe in pregnancy. In fact, it is safer to be immunized against the flu than not, as pregnant women, particularly those close to term, are among those most at risk for complications from the flu. Having the flu shot has been shown to decrease low birth weight infants and preterm birth. Also, the antibodies pass through the placenta to protect the baby after he or she is born. So lend us an arm and protect yourself and your baby from the flu. And bring your partner. Make it a togetherness activity. Well, this is going to be such an exciting ride. Buckle up, and we are with you through it all. And speaking of buckles, once that lovely bump arrives, the proper placement is under the bump and between the breasts, not on top of the bump or on the side. Think about cradling the baby. That's all from us. Please refer to our website for other useful links and information that will be relevant for you during your pregnancy. And please check out the further information on prenatal genetic screening by Dr. Caitlin Harmon. All the best.